Hello everyone and welcome to our Learning Disabilities webinar. Our presenter today is Anna Gutierrez. Can I just ask a couple of housekeeping things? If you can turn your cameras off, it will help because Anna will want to share the screen, and if we can avoid other images, it just helps avoid further distraction. The slides for today's presentation will be available, so we will put them on our website, but we will also circulate them via email. If you have questions, do put them into the chat box. If you can't do that, there'll be time at the end. You can raise your hand and we'll answer questions then. The presentation is being recorded, and the recording will again be put on our website. So for any of your colleagues who can't make it, they can have a run through from the video from the website. And without further ado, I'll pass on to Anna and go ahead. Just a second reminder, please, can you all switch off your video images? Dr. Dittel, would you mind being able to switch your camera off? Thanks. I shall now switch my camera off as well.
Thank you. I actually like looking at people's faces, but it just doesn't work with such a big group. So hello everybody, welcome. Glad to have you here today. So without further ado, let me share my presentation. Sorry.
I believe Anna is frozen again, guys. Give me 2 moments. I'll see if we can get her back for you.
So while we're waiting for Anna as well, just to remind people, we'll also have a feedback form which we'll post in the chat as well. And I would really appreciate if you can give us feedback on the content of the webinar and potential topics for future webinars.
She's just going to restart and she should be with us in a few minutes, all right?
Can you hear me now?
Yep.
I have absolutely no idea why it froze. Okay, I'm trying once more. Can you hear me now?
I can still hear you.
Good. So you are keeping a register. Sorry, I've moved my stride now.
No problem.
Okay.
Yeah, we can still hear you. We can't see any slides though yet, Anna.
Can you?
No.
Okay, right. Let's go ahead. Oh, what is going on? The last one went so well.
It did. It's the wonders of technology.
I just understand it. Everything okay now?
Yeah, everything's working fine.
Oh, okay, lovely. So you've got your core register, which is nothing new, 4 QoF points. Then you've got your quality improvement for QoF, which is new and which has got a lot of points attached to it. For an average size practice, that would be 7,000. So for big practices, much more than that. And then you've got your learning disabilities health scheme, which is how they call the DES these days, which is somewhat confusing, but it's exactly the same. And you're still getting £140 per annual health check, which again can amount to quite a lot of money. the payment for your health scheme comes through CQRS, and it gets extracted automatically from your clinical system. The only thing that you have to do manually is to input your register size. Very strange, I know, but please do it, because otherwise all the data the NHS digital publishes is not accurate, and it might make your practice not look good in some ways. And then we've got Stomp, which our new friends, the pharmacists, know all about, but some of you might not be so familiar with, but we'll come back to that. So what about QoF? What is QoF asking you to do? So QoF in the quality improvement module identifies some basic areas for improvement that you have to address. So you establish a baseline of where you are, and then analyze where you need improvement, and make a plan of how you are going to achieve that improvement, and review what you've learned and how that has been embedded subsequently. So those basic areas for improvement are what they call finding, which is what we at CG call prevalence improvement, and we've been doing it for many years with you, and what used to be called just keeping and maintaining a register. And we'll go back to that. Staff training this assessment is another area to consider. Your uptake of the annual health checks, which should be 75%, and not all localities managed to do this last year. I'm very proud of Tower Hamlets because they did manage, but I'm sure this year everybody's going to do much better. And of course, the annual health check has to be done using an adequate template, which covers all the management areas, and naturally the CG template is compatible with these requirements. Health promotion is very important as well, because, for example, learning disabilities patients tend to get more cardiovascular disease, so it's particularly important that they don't miss their long-term condition reviews. They tend to engage less with cancer screening, for example, so you have to try new ways of engaging with them to try and bring them in. For example, we give you in our template, we give you a link to a video that you can play to learning disabilities women about smear test. That might be helpful. All that kind of stuff. Reasonable adjustments, so that's something that you have to consider as well. Recording the communications preference, for example, if they need easy reading documents, and of course not just recording it, but also acting on it. And if you're doing really, really well on all that, they say, well, go further and do a project on the level of antipsychotic prescribing, or study their secondary care activity, whether there is too much or too little, whether they are DNA or not. And it's important also to sign them up for the summary care record with additional information. To be honest, when they wrote this was written before COVID. At the moment, we're under COVID special rules, and everybody who had a core record has got it with additional information, but this is supposed to finish after COVID, and you're still encouraged to ask them to consent for once COVID is over, so that they can always have the additional information. When it comes to identification, I'm not sure if everybody knows that till the 1st of April, there was a very limited code set that would include someone in the register. These codes were mild learning disabilities, moderate learning disabilities, etc., or the much easier code on learning disabilities register, and that was it. Like, it was only about 6 or 7 codes, but these had a problem. Many clinicians, for example, thought, well, if I've already coded the patient as having Down syndrome, why do I have to code it again? Of course, they've got a learning disability. So to avoid that, NHS Digital have published new rules, and now there are above 250 disorder codes, including Down syndrome, which will put the patient in the register immediately without you having to code the learning disability code. However, if they're still not there, and they should be, all you need to remember is to code on learning disability register. You don't need to remember about all the other codes, just on learning disabilities register. That's all you need to do. We were hoping to have by now a code for suspected learning disabilities to be used for children. unfortunately, it has been delayed because of COVID. So COVID codes have taken priority, and even though we requested this code from NHS Digital before the summer, it has not been published yet. And you are encouraged to use what they call a clinical inclusion tool, which would look something like this, like a questionnaire of yes, no, that will tell you whether someone is likely or not likely to have learning disabilities. You will have all this in your resources. And we are providing you with prevalence improvement searches based on a document issued by NHS England Improvement last autumn. They ask you to search for these patients to see if they should be added to the register. I believe that the search at the top they may have is about a 50% hate, and they might have is less than that. So they recommend that you do the one on the top before. Some practices and some localities already did this kind of work last year, and it would be silly to go all over it again. So for them, we've created the refresh search. So you only need to do refreshes every quarter. And we provide a monthly dashboard where you can see how you are progressing. As you can see in this particular locality, there is a big jump in April, and that's when the code set was expanded. So that was a jump without doing anything at all. Whereas the jump in August seems more like a product of actually looking at who else should be included. So I'm going to try and log on to EMIS. I hope you don't get disconnected. Sorry. Sometimes technology drives me mad. Not always. I mean, I'm usually okay.
We shall do a webinar on how to best get the most out of MST.
Yes, please. But sometimes there are things that you just can't fathom. Come on, Emis, don't do this to me. Not responding. I'm sure you are familiar with this screen. Okay, so I forgot to say at the beginning that I am more familiar with EMIS systems, and particularly Tower Hamlets and Waltham Forest, because that's where I work. But we do all our tools for all localities in the 7 localities in NEL, and also for System 1, although System 1 always comes with a little bit of a delay. So this is an example of what you are going to find in our learning disabilities support searches set. So this is the one I was talking about learning disability prevalence improvement. You also have the cancer screening one, so you can do a quality improvement project where you run this with date 1st of April, for example, and then you aim to have, I don't know, 50%, 5%, sorry, 50% is a lot, 5% improvement by the end of the year, for example. You could do that. So you've got bowel cancer, breast cancer, and smears. You could also do a quality improvement project with with flu vaccine for learning disabilities. So, for example, you could look at this and see what your performance was last year, and again aim to have, I don't know, an extra 10%, 20% improvement. This is your flu vaccination recall search. In Tower Hamlets, we've got priority for certain groups, but that doesn't apply to other areas, although you might be advised to do something similar. This is just your basic recall for health annual checks, and it will also look at whether you've done the health action plans. And here you've got your STOMP. So STOMP is about prescribing antipsychotropic medication wisely, if you want. So it's about not giving antidepressants or anxiolytics or antipsychotics to patients for the sake of it, like, for example, to manage what is perceived as challenging behavior. So you are advised to to review the medication for these patients once a year to make sure that it's still appropriate. So, for example, if I've got 185 patients here who were with learning disabilities, which may include autism or may not, and 77 of them don't have a diagnostic code of depression, OCD, or eating disorders. I would guess that many of them have got codes for low mood, for pain, for sleep issues, etc., etc. Whatever the reason, it's important to review all these patients, even not just these, but these ones as well, to make sure that the prescription is still appropriate. And secondly, to see if you need to add them to a register or add a diagnostic code. For example, that low mood might be more like depression by now. And the same applies for adults with the autistic spectrum, but these ones have not got learning disabilities. And there is a similar set for children and young people. So these are the searches that we are recommending to you to help you out with all your management. And we also have a template. Where is it? So except for BHR, where you, because you are not resource publisher yet, it's very difficult for us to provide you with smart templates. So we have to provide you separate templates. But in all the other localities, you've got long-term conditions review templates, which cover everything. And you will find the learning disabilities as a page in that template. And that page will only appear if the patient has got learning disabilities. And I thought I had it here, but I've obviously made a mistake. This is not the demo template that I was looking for. I was looking for one that would come up with the learning disabilities page. Oh dear, why is it so slow? And I have a decent internet connection as well. Right, so here we are. So the main page where you land will be your usual things like weight, blood pressure, rate scores, all the usual stuff, care status, etc. Slightly different in different localities, but more or less the same stuff. And then you've got your learning disabilities page, which will be the same for everybody. So we first give you a reminder that you should try and seek consent to for the additional summary care record, which means that instead of the hospitals, for example, seeing just allergies and medication, they will also see things like the problem list or their DNR wishes, or more importantly, their communication support needs. The communication support needs can be recorded in the communication support page, which is in line with the accessible information standard that came out in 2017, I believe. And we know that these codes will transfer to the summary care record if with the additional information. You are advised this year as well to review the do not resuscitate status, and you can do that in the end of life care page. Other than that, of course, you need to click on tick this box to say that you've done the review, and there are all sorts of clinical assessments that you need and that you need to go through, including cancer screening. This particular patient is male, so you've got a section of testicular examination, but if it was a female, you would see something about smears and mammography instead. And of course, you can give them the flu jab at the same time. Okay, I'm going to go back to the presentation, and I think I've covered everything through the EMIS. In case I couldn't show you EMIS. Oh yeah, we've got health action plans as well that look a bit like that, easy to read, not very busy. Yeah, able to show you all this, so I don't have to go through it again. So yes, of course, contact your facilitator if you have any queries. So I'll stop presenting if I can. Come on. Here we go. And I can take questions. Any questions? Remember that we'll give you we will give you handouts with more information so that you can digest it properly, and you can always ask us questions farther down the line.
Yeah, so we have a hand up from Susan.
Oh, hi.
Hi, it's me again. You said about the templates with Resource Publisher.
Yep.
Now, we've had an email come out to the practice that we're supposed to be having this updated on the 27th of this month.
Wow.
So how will that work with our existing templates? Will this be updated into this all the singing and dancing template, or what happens?
It will have to be gradual, obviously, because we cannot. But the way we did it in the other localities is that we put all the existing templates into Resource Publisher, publish them, and ask the practices to archive all their current ones, everything.
Right. So should we notify our usual contact to say, right, we're being upgraded to Resource Publisher,
Yes,
and then you'll help us?
Yes,
that
please.
be appropriate?
Yes, please. But please do realize that although it's important that we know that you are being upgraded, we will probably be the last to be upgraded. So we won't be able to support you as soon as you are upgraded. See what I mean?
Okay, sure. Okay, thank you.
Yeah, we will support you all the way.
Yeah. Okay, lovely. Thanks.
I have a message in the chat from Jackie. Can we be sent a list of the recodes used for bowel screening?
Right. Okay. Do you mean like to record the results? Because we've got a template for that. Let me make a note of that, and we can come back to you, Jackie. I will come back to you.
And she says, yes, especially the non-responders.
Right. From the top of my head, but we've got templates for that. Yeah, no problem. Any other questions?
Yeah, I have one from Vipinda. Do we have targets for the quality of the learning difficulty patients?
You mean the quality of the reviews, I suppose?
Yes, quality of the reviews. Sorry, it wasn't very clear.
I haven't. No, that's fine. That's fine. I haven't seen that anywhere. I mean, it's implied in all the documentation that the reviews have to be of high quality, which is why we've got a long template. But I haven't seen anything specifying that there's going to be an audit about that. The only thing that there will be auditing is that you've ticked the box saying that you've done a health action plan. But again, I don't think they will be auditing the quality of the plans, which is unfortunate, of course. Well, unfortunate in terms of quality, but easy in terms of yeah.
Because I'm looking at our statistics. We've got 34 on the register.
Yep.
None of them have got a DNR in place.
Okay.
And I'm just worried about the quality. And we've only hit 30. I'm not sure. Had a flu season. 58% have had a flu jab.
Okay.
Which is
that's
not very high.
But that's very average, actually.
Yeah, but I mean, with COVID, we should be doing a bit more because they're the highest risk of, or one of the high risks.
Can I also say that it is allowed, if they are needle phobic, you can give them the intranasal vaccination.
Mm-hmm.
So that's quite useful. But yes, you're right. Yes,
I didn't know that you could give intranasal. Okay, I thought that was only for children.
I know, but I learned so much through doing webinars because with people's questions, I have to research more, and then I learn new things that I can tell people on the next webinar. So that's really useful. As for the DNRs, what happens is that in the past you never had a requirement to do this, to ask them, unless they were on an end of life care pathway. I think the requirement has been introduced in a hurry at the end in the specification because of the scandal that there was about care homes. So that's probably what it's about. So I wouldn't be surprised if they didn't have it before. And I think that's why they want you to review them to make sure they are appropriate.
And then on the prevalence finder, I guess everybody struggles with this, how to actually, I mean, coding them is easy. It's actually getting their consent, because you can't really put them on the register without their consent. Some of them have just been given a diagnosis of autism, but they might be high functioning.
Well, but then they haven't got learning disabilities, do they?
No, but it comes up on the register, may have, but not on the register.
Exactly, so you just ignore it. And next time you do the exercise, you will just do the quarterly refresh. So just ignore it. Just
ignore it. I can't take them off that. May have. Okay.
I'm afraid not.
Okay. And finally, to stomp, I get the pharmacist to have a look at this, because I think that'd be quite a lot of work to do.
It is a
and
lot.
there are no targets on this yet, but there will be,
no
I'm sure. Thank you very much.
No problem. Thank you very much.
We've got a question from Jakia.
Hiya.
Jakia, you've got your hands up.
Jakia, you must be on mute. I think you're on mute. Oh.
No, I can see they've unmuted, but we just can't hear them, unfortunately.
Oh, they must have mic. They must have problems with their mic. Oh no. Can you write your question, perhaps?
Sorry, can you hear me?
Yes, can hear you now. Yep.
Thanks, Jackie. Sorry, I must have missed the first part of the session where you're explaining the template.
Okay.
Clarity around the actual template that we're using for LD health checks. And I understand that's part of the DES work this year.
Yep.
So in order to capture the numbers, what template are we completing? I just need clarity around that.
Okay. Which locality do you work at?
Redbridge.
You either have or will have in the next day a dedicated learning disabilities template, because you don't have resource publisher, you don't have a long-term conditions with a learning disabilities page embedded in it, but you will eventually. But for now, your facilitator will email you a learning disabilities template.
Okay, so the work that's been carried out already, because we've started our reviews from. What would happen? Would that incorporate the information onto the new one, or do we have to manually update?
It depends on how you were coding the reviews.
So we would have worked according to what the POF template tells us to do. So we would have gone through the GP contracts.
Okay. I would imagine that is the same code, but we can double check and confirm for you.
Thank you.
No problem.
The template went out to BHR about half an hour ago, Jakia.
Okay.
So you should have received the email already.
Oh, that's great. I've been on these webinars since. Thank you.
But we'll check that if it's the same code and come back to you. Anything else?
Thank you. That's helpful.
Thank you. So I think we can wrap up now, Keith.
Okay, well, thanks everyone for turning up today. Hopefully you found it a useful exercise and learning disabilities. And please do complete the feedback form, because we hope to offer more webinars in the future. All your feedback is very welcome. Goodbye, and thank you all for attending.
Goodbye.